Welcome to Quantum Biofeedback and Bioresonance Scan. Thank you for taking the time to investigate what this is all about. My name is kimjholden, and allow me to introduce myself. I am a medical office and medical laboratory assistant. I've been a medical clinic office manager, an alternative healthcare manager, and I am a certified biofeedback and bioresonance scan technician. And I want to put it right up front that I am not a medical doctor and I do not diagnose illnesses. I am an energy practitioner working with frequencies. So that basically is what we're going to be discussing today, is frequencies and how we can actually get healthy. So this is about the quantum bioresonance and biofeedback scan. Our scans go into the various organs at a cellular level to find where the frequency is out of alignment. This technology actually was developed by Russians about almost like 30 years ago. So it's a relatively new system that's offered to the community, but the information is about 30 years old. All right, so we're going to look at how we can analyze the body's organs and help them with their function. You know, dealing with frequencies isn't really all that new, honestly. Although for some people, they haven't really heard about it. We know that everything is energy. This stated by this quote by Albert Einstein: everything is energy, and that's all there is to it. Match the frequency of the reality you want, and you can't help but get it. And this is not a philosophy, it's actually physics. So this is, you know, very definite, and it's not something that's new to us. If you look at here, we have a picture of an EKG or ECG. It's actually measuring the electromagnetic energy of the heart. It's looking at the beats, and from that they can ascertain whether or not the heart is having any issues. And we all have our laptops, computers, our cell phones, and again, we're dealing with frequencies. I mean, how is it possible that you could go to China, and if your plan allows it, I could call you from Canada and you get that call in China? How is it possible? It's technology that I personally don't understand, but I'm certainly delighted to use it. So it is use of frequency is not unreal. It's not something that's out of our reach. It is definitely something that we are using every day. It's very normal to us. But how does the scanner help us? What does it do for us? Well, what it does is, if we liken this to gardeners, to people who love gardening, if you want to grow beautiful vegetables or have gorgeous flowers, you have to provide it with the correct environment, the correct soil, so that they can grow healthy. If you don't, then you're going to have weeds. And some people have a beautiful garden of weeds, because why? That's the soil that allows them to grow. Now, if we liken that to our body, how then does a scan change our environment? Well, what it does is it looks again at the electromagnetic energy in the body, and it identifies what organs are not working correctly. They may have too much frequency or too little, and then the scan actually gives the correct frequency so that the organ can function at a healthy level. Just like everything is vibrating, but as we continue to give it healing frequency, it keeps vibrating, but now it moves up to the level that is healthy and correct for that particular organ. So really, to change your environment, all you need to do is do this scanning so that you are now functioning at a proper level for your body. And the body, the scan can actually, there's about 1,100 scans within the system at this point. We would never scan that much, it would just be an overload. But if it's in your body, we can scan it. And we will actually look at the cellular level, which means we'll be able to detect a frequency before it can be detected elsewhere. Now, I'm going to give you a couple of examples and this one here, what I'm going to show you is the frequency. These are the ratings that you're going to see on the photo. So I just want to give you an idea, a heads up. The 2, 3, the 2 is like perfect, no problem. The body's handling it's in the right environment. But when we get down to 4s, 5, and 6, then it's become acute or a chronic issue that we need to look at. So we're going to be looking at these black squares. So here's an example of a heart valve. You can see on the left that we have a couple of 6s, a lot of 3s, but we actually, by giving it therapy, we now are at a 70% strengthening. Look at all those beautiful 2s. It's perfect. And at this one here, this is the last bronchial. In this particular case, we found the frequency for bronchiogenic cancer. Now, we tested it and it's weakening him by 12%. So this person, I advised him to go to the doctor, and the doctor actually had seen him 6 months ago and had a physical, and he had, he was in perfect health, although he was a smoker. And it turned out that, yep, she did the x-ray, and 2 days later she called him and said she had some news for him, but not to worry because it was caused by smoking. So that was very helpful. Now on this one here, you see over here, the breast has a lot of blacks. There's a lot of issues here. And 2 months later, we were working on it, and now it's strengthening by 81%. That's a huge improvement in this person's breast tissue. So that was great. And with the times, we've been concerned about the coronaviruses. Now, we have to keep in mind with a virus or a bacteria, we don't want it to be healthy and living strong. We want it to be very weak and then non-existent. So in this case, as you can see, we had the number 5. There's a few 6s here, but after giving it therapy, we weakened it by 63%, and it's just about all black, and that's where we want it to stay. Our next one, our next example, pardon me, is body pain, muscle pain. This person, all black. We gave it therapy and improved by 82%. So that was outstanding. This one here, the organs of the female, we gave it therapy and it strengthened by 23%. But I want to draw your attention that this is for a PAP. So women who get a PAP test are looking for cervical cancer caused by actually papillomavirus. So we were working on this over time, and we got it to strengthen 23%. When there is a pathogen, when there's a microorganism or a bacteria, if it's strengthening like this, then it's dead. Okay, so this, the patient very confidently went to her doctor for her next PAP test, knowing that the PAP had actually subsided, and in fact, the PAP test came back negative, that she did not have it anymore. In this case here, we have a prostate tissue, and after, I believe it was a month, just in a month, it had strengthened 29%, which was excellent. And this client noticed a drastic improvement in urination after his sessions, because with prostate, when that inflames, it actually infringes on the urethra. So I got a phone call about that. He was so thrilled. This one here, we have pictures on the right of a mammary gland of the breast. The machine brought up the frequency for lipomas, and it was weakening her breast by 9%. So I have it circled here that this was the area strongest, as you can see by the 4s and 5s here. So this gave the woman peace of mind, because when she actually went to have the test done, she knew it wasn't cancerous. That was her fear. And she, had been told it was a lipoma, it's a fatty tissue. So here she brought back her actual ultrasound results. And if I could just draw your attention to the part here where it says it was located at the 5 o'clock position, which is, if you look at a clock, there is 6 and here is 5. And then, it mentions down here, it's a fat-containing mass in the lower right breast, confirming what we had found. So that was actually fantastic. Another service we can offer you is if you want to test any of your vitamins or anything, we can actually put it into this cup and the machine will let us know whether or not this product is weakening you or healing you or strengthening you, that this is something good for your body. So that's another option that we have. And our last one is we actually can now do a snippet of a dog's hair or nail, and we can scan them from a distance and we can find out what's going on in their body. So imagine your veterinary bills coming down, or at least knowing some of the foods that the dog can't tolerate. Very, very important. Let's face it, dogs are like our family. All you pet owners out there, I'm sure you would agree. They're, sometimes we might even love them more than some of our family members. So our dogs are very important to us. So how did I get into this? Like, how was this point? There's only about 15 of these machines in Canada. There's where I'm from. There is more in the Europe and the United States, but in Canada, it's still very, very new. So I got onto this because I have a strong medical family history of cardiovascular disease. I would get my checkups. I'm fine, not so well for other family members. And, I asked the doctor about it and he goes, well, as far as the machines were telling him, I didn't have an issue. But if I, really wanted, I could go to St. Mike's Hospital downtown Toronto, and they could do this other test. It's like an MRI, but you don't need to. So it's just totally up to you. So I ended up working with a person who actually had a scan. She scanned me, and it pulled up the top 5 in red problematic frequencies of pathology, all had to do with diseases that I knew family members had died from. So I picked up the phone, called my cardiologist and said, yes, I want to go to St. Mike's. And I did. They found that, yes, I did have one of the pathologies, but it was still low enough that I didn't require to go get any surgery or any procedures done. So the point about this is I now know what I need to be working on, what I need to do. And I didn't have to wait to actually have a heart attack to clue into my health issues. I'm able now, because I got my heads up that my history was going to go down this road. And if I want to do something about it, then I'm in control now. I don't have to wait for some devastating news and then what am I going to do about it? So this is why I got into the scan, and I'm offering it to people so that we can, all enjoy a healthy life. So who should really get a scan? Well, frankly, everyone should get a scan. If you're frustrated with your health and no one can find out what's wrong with you, you need a scan. If you take your life for granted, your health for granted, and you just figured, I'm not going to do anything about it. Well, frankly, you still need a scan. You need to find out before it's too late what is lurking in your body, what environment needs to change. Think of your friends, your loved ones, people you meet who are struggling to know what's wrong with them. They need the scan to give them the answers, to find those frequencies, to change that environment or the soil so that they can produce the correct product that they want in their health. And honestly, just for peace of mind, if you think there is absolutely nothing wrong with you, your life is great, just have a scan for peace of mind so that you know that there is nothing that you're unaware of. Take control of your health. And if you go to your doctor for your annual physicals, once a year, get a check. Well, the same thing with your scan. At least once a year, get a check so you know what your frequencies are in your health. So how can I do this for you? I can scan you in person. I can use a Zoom. We can do distance sessions with it. Just give me a piece of your hair or your nail. And if you're really into energetic medicine, all I need is your date of birth and your full name. And just like a cell phone, the scanner will find your frequency. And this has been proven. So for more information or to book an appointment, this is my contact information here. And give the gift of an appointment for yourself, for a friend, or someone you love. This is my contact information. I thank you very much for taking the time to watch this to the end, and let's improve our health one scan at a time. Thank you.